in Limpopo, where another attack on the rural clinic has been reported over the weekend. Two men who targeted the Mashamba Clinic in Thohoyandou entered the clinic pretending to seek medical assistance before carrying out the alleged attack. This comes just 2 months after two nurses on night duty in Chuene Clinic were abducted and raped. Is safety at rural clinics now becoming a growing concern? Let's now speak to the Provincial Health Spokesperson, Shikwambana. Neil, a very good morning to you. Thank you so much for making time for us this morning. According to your investigation, what happened in this incident?
So, as you correctly stating, Aldrin, the two assailants targeted the Mashamba Clinic, where they pretended to be bringing in a patient, and when the security personnel opened for them, they pointed a firearm at them, demanding their firearm. Fortunately, the security officer at the gate was on high alert, where she actually told them that the firearm is inside the building. In the process, there was commotion, and the other security personnel had that and managed to hide the nurses for safety who were in the facility, and they sought assistance from the nearby household. It's the issue of attack on health facilities is actually a growing concern, and it has been so for quite a number of years now.
Round about what time did this happen?
This is said to have happened at about between 9:30 and 10:30 in the evening.
Yeah. So again, it's another 24-hour clinic that has been impacted by crime. What's the next step for the Department of Health in relation to this?
Yes, that's another 24-hour facility that is targeted. What we have observed, Aldrin, although I've already indicated that this has been a concern for a number of years, is that though these incidents are continuing, but they seem to be coming down in terms of figures, because if you look at it now, between January and now, we've only reported 4 incidents as compared to the previous years, where you will have an average of 4 to 5 per month. But still, one attack on one clinic is still too many, because it sends out shivers down the spines of healthcare workers who will then not feel comfortable to work at night. And the main thing that we've actually observed on our analysis is that part of the vulnerabilities that our facilities have is that, number one, they operate at night. Number two, mostly those are targeted in the rural areas where the response would not be as quick as in towns, because we don't see this kind of attacks on clinics that are in towns. Number three, the main issue that criminals seem to be targeting mostly is firearms, as opposed to the incidents where personal belongings such as cell phones and money or government property gets taken. So as we look at this, we are continuously on talks with the South African Police Services to see how we can improve the situation, particularly for those facilities that are in the most rural villages. I remember when these attacks were on the high in the past few years, the then MEC, Dr. Popura Matuba, who's now Premier, actually went to an extent of meeting the police commissioner then to see if we can't have a working relationship that is like that in the past, where you would have South African policies having the guarding division, but those are legislative issues which might need laws to be amended and so on. But if these don't abate, we might need to go to that extent, because when facilities are threatened like this, it's the lives of people that gets threatened and get lost in the process when clinics are not opening at night, especially for the poor and vulnerable who are living in the rural areas.
Yeah. And with the Mashamba case, has anyone been arrested?
Not as yet, but we also want to applaud our security personnel in this instance, because in most cases they become the first target of criticism when we have this. They are high alertness, and also their dedication to save the clinic, actually save the day there. And the police responded quickly. That's why we did not have anything taken at the clinic or anybody sustaining serious injuries. So far, police are still investigating. There's not been an arrest.
Yeah. With the Chuene case, what the government had decided there was to close down the clinic first, and then later on we were told that the service won't be running for around 24 hours. Before we get to Chuene, please tell me what is the approach with Mashamba Clinic? Are they going to have a similar fate where the clinic has to shut down?
It's not a decision that has been taken as of now, but after the incident happened, we needed to take into account the safety of healthcare workers and also their psychological well-being. We had to give them rest, but government officials will meet community stakeholders today to chart a clear way forward and see how this can be dealt with. So we should be able to take that particular decision. The closing of the clinic is mostly something that we don't necessarily desire because it deprives of the community of an essential service. So we have to consult thoroughly with all stakeholders involved, such as organized labor, clinic committees, traditional leadership, and so on, so that we see how we help each other moving forward. But so far, there hasn't been a decision of that sort that has been taken.
So is Mashamba Clinic operating currently?
Yes, it is still operating.
Okay. And what's the update on Chuene Clinic?
Look, the Chuene Clinic is that it's operating during the day. There's no night service happening there so far. You would remember that the alleged perpetrator of those heinous crimes has been arrested and he has appeared in court, and he will again appear in court in the coming month.
Yeah, and just finally, just reiterating what you mentioned a bit earlier on, 4 incidents, you say, of this nature that have taken place since the start of the year.
Yes, we have had an incident at the Panama Clinic in Sekhukhune where security, this is not a night clinic, it operates during the day. It was closed, but there were security personnel there who were accosted and their firearms were taken, including the computers in the facility. We've had the Chuene Clinic, as you are pointing out, and another incident that has happened in one of our facilities. So since January until now, we have actually recorded 4 attacks, not to mention the Philadelphia case, because there it was mostly not necessarily criminal, it was necessarily outside criminal, so it was a fight between patients.
Yeah. Okay, thank you so much for your time. Shikwambana is the spokesperson for the Department of Health in Limpopo.